Hi, my name is Colette Hooper. I'm a nurse practitioner. I'm employed by the Rural Support Service Diabetes Service. Welcome to the Continuous Glucose Monitoring in the Inpatient Setting training package. So the learning outcomes for this training package are for you to identify the advantages of continuous glucose monitoring or CGM in people with diabetes, identify when to support the use of CGM in the inpatient setting, and when CGM might be contraindicated, for you to understand and state the management of CGM and what action needs to be taken in the event of system failure, and importantly, when it might be advantageous to refer to a diabetes specialist nurse or credentialed diabetes educator for the person with diabetes using CGM during the course of an admission. So congratulations on locating the training package. In future, to access the RSS Diabetes Service SharePoint page and the resources contained in it, it's 2 steps from the Regional Hub homepage. On the top toolbar, step 1 is to click Clinical. Step 2 is either to click on the Diabetes Services listed on the left-hand side menu or click on the Diabetes Services tile offered in the middle of the page. Once on the Diabetes Services site, click on the Protocols and Procedures listed on the left-hand side menu. All of our protocols and related resources will then be offered. I've highlighted the CGM in the inpatient setting protocol as this is relevant to the training package today. Regional local health network hospitals and health services have noted an increase in the number of people with diabetes admitted with CGM systems. Evidence-based clinical practice guidelines improve the quality and safety of clinical care. Regional local health network clinical governance committees have approved the revised protocol for use in our hospitals. This protocol provides the available evidence to facilitate people with diabetes self-managing CGM systems at the time of their hospital admission to continue to do so during their hospital stay where appropriate. The use of this clinical protocol will be monitored and is scheduled for a review again in 2026. The flowchart offered in this revised protocol provides a pathway for you to use from when the person with diabetes using CGM is admitted right through to discharge. It provides key information on the roles and responsibilities of the medical officer, nurse, midwife, and person with diabetes or their parent or carer. Glucose measurements are critical to effective diabetes management. Although measurement of glycosylated hemoglobin or HbA1c has been the traditional method of assessing glycemic control, it does not reflect the glucose excursions that may lead to hypo or hyperglycemia. Self-monitoring of capillary blood glucose has been demonstrated to improve glycemic control and quality of life. However, this requires multiple finger prick checks at discrete time points before and after meals and activity, and this method cannot predict impending hypoglycemia. Continuous glucose monitoring addresses many of the limitations in HbA1c testing and self-monitoring of capillary blood glucose. CGM is used in the management of a growing number of people with diabetes, and statistically in 2019, the Australian National Diabetes Audit reported that 62% of children and young people with diabetes and 23% of all adults use CGM. More recently, in 2022, that data percentage has increased to over 80% in children and young people with diabetes and over 60% of adults using CGM. People with diabetes who use CGM develop expertise in the use of their systems to monitor and manage their condition. They, of course, then are quite reluctant to cease using their CGM system when they're admitted to hospital. It is important to participate in decisions and choices about healthcare and promote self-management to achieve the best possible outcomes in health. Continuous glucose monitoring measures interstitial glucose approximately every 5 minutes to provide a sensor glucose result. Many systems offer a predicted glucose trend to the user in real time to identify dietary intake, physical activity, stress, illnesses, steroid medications, and menstrual cycle influences on glucose. Some systems can be linked to blood glucose meters, compatible smartphones, and/or insulin pumps, which can then display the interstitial glucose result, a recent history, and alert the person with diabetes and/or their connected parent or carer to a glucose excursion or trend, moving above or below their glucose target. When CGM systems are linked to an insulin pump, systems can provide sensor-augmented pump technology, SAPT. SAPT can be programmed to automatically suspend insulin delivery if the interstitial glucose falls below target, or administer micro-correction bolus insulin doses if the interstitial glucose rises above glucose target range. Some CGM systems and interstitial glucose sensors have been approved to direct insulin doses without requiring finger prick checking or calibration. CGM is particularly useful in lowering HbA1c and increasing time in range, in reducing hypoglycemic events and duration of time below target glucose range, is particularly useful in children and young people with their erratic lifestyles and behaviours, and particularly useful in women who are considering pregnancy or who are pregnant in regards to HbA1c, improvement in time and range, and improvement in neonatal outcomes. There are limitations to the current CGM systems. They include various accuracies depending on the system that is chosen, lag time. Current CGM technologies currently provide a lag time of approximately 4 to 5 minutes behind a blood glucose result. The image illustrates the potential lag time between blood glucose and sensor glucose. There is greater difference when the blood glucose level is changing more rapidly, such as when a blood glucose level is falling, interstitial glucose may be higher, or when the blood glucose level is rising, interstitial glucose may be lower. There is discomfort, but it is minor at the time of the insertion of the CGM sensor. However, there is no expected discomfort when wearing the CGM from there. The CGM sensor is worn 24 hours a day and it cannot be removed. If it is removed, it can't be reinserted. Data collection is ceased and a new sensor is required for data to recommence. There is a risk of infection, and this is small, but is reduced when using a sterile technique to insert the sensor and protecting the site where the sensor is inserted with a dressing. Some systems actually have interference with paracetamol, resulting in falsely elevated sensor glucose results. Mechanical faults, of course, can occur, and the current CGM systems, importantly, are designed for the ambulatory setting only. In Australia, any person with diabetes can access CGM systems. However, via the National Diabetes Services Scheme, only those with type 1 diabetes can access either fully or partially subsidised consumables. The table offers you the current CGM systems available in Australia, which are either compatible with an insulin pump, a smartphone or smart device, or a reader. The lifespan of the consumables does vary, with the sensor lifespan between 7 and 14 days, and the transmitter, which connects to the sensor, between 3 months and 12 months. To apply most CGM system sensors, a small, sterile introducer subcutaneous needle is inserted just under the skin using an applicator. The needle is then removed, leaving an even smaller plastic electrode in place. At the end of the electrode is the glucose sensor. The sensor is then attached to a transmitter and covered by an adhesive see-through dressing or patch. The Freestyle Libre 2.0 continuous glucose monitor has a sensor which has a self-adhesive backing which holds it in place, and therefore an additional see-through dressing is not required. For people with diabetes who are keen to continue to use their CGM during the course of an admission, they will, or their parent or carers, will need to provide the CGM consumables to do so. In addition to an interstitial glucose result, CGM systems also offer trend arrows. Trend arrows predict the direction of travel of the sensor glucose at any given moment. However, it is important to note that both the magnitude of change and the expected duration of the trends indicated by the arrows are presented differently by different products. The image is an example. Current CGM systems also offer alarms when interstitial glucose levels are predicted to or reach predetermined high or low levels. Remote monitoring and alarms are particularly beneficial to those persons with diabetes with impaired awareness or reduced ability to recognise and communicate symptoms of hypoglycemia. The image offers examples of some of the alarms that can be programmed. In addition to the real-time interstitial glucose result and trend arrows, the CGM systems are also able to generate significant data by way of reporting. The various CGM system reports, whilst not standardised, offer the following key metrics to assess glycemic control: sensor capture data completeness, low glucose events, estimated HbA1c, percentage of time below glucose target range, in target glucose range and above target glucose range, coefficient of variation, standard deviation, and individual day data graphs. Reports to identify the glycemic control of a person with diabetes admitted to a hospital will require referral to the diabetes specialist nurse or credentialed diabetes educator and will be dependent on the availability of the appropriate software. As identified earlier, people with diabetes develop expertise in the use of their CGM systems to monitor and manage their diabetes independently and may be reluctant to stop using their CGM system on admission. The importance of participation in decisions and choices about healthcare and the promotion of self-management to achieve best possible outcomes in health is well recognised. The revised protocol supports clinical decision-making for managing CGM systems in the inpatient setting. The protocol aims to assist you to determine appropriate healthcare for the management of people using CGM. On admission to hospital, either to a ward or emergency department, the person with diabetes must demonstrate to the satisfaction of the assessing healthcare professional that they have the ability to use their CGM system and understand how to modify the settings if required. It is acknowledged that the assessing healthcare professional may have limited exposure to the practical management of a specific CGM system used. Competency assessment, therefore, will involve asking the person with diabetes, their parent or carer, to demonstrate that they can identify the CGM system used, can identify the sensor glucose result on their connected blood glucose meter, insulin pump or compatible smartphone, and are able to identify the sensor glucose result by scanning the sensor with the reader or compatible smartphone, if required, that they can recite their CGM sensor when it might be due, that they can demonstrate technical competency regarding the CGM sensor site and how they might troubleshoot if an error or a failure occurs, that they can undertake appropriate problem-solving actions of blood glucose and if their sensor glucose is higher or lower than target, that they have adequate supplies of CGM consumables for the anticipated duration of the admission, and that they have been performing regular blood glucose tests in addition to maintaining their continuous glucose monitoring system. An opportunity to consider referral to the diabetes specialist nurse or credentialed diabetes educator should be considered if there is any concern about the competency of the person to continue to use their CGM during the course of their hospital stay. In children and young adults who are dependent on their parent or carer, in the management of CGM, the parent or carer must be in attendance at all times to assist with the daily CGM tasks required. In obstetrics and gynecology, labour and birth is not an absolute contraindication in the use of CGM. And in surgery and fasting procedures, CGM is not contraindicated in operating theatres or procedure rooms. If the above conditions cannot be met and the CGM system needs to be discontinued, then the device must be managed according to the hospital policies for storage of valuables. The use of CGM systems is contraindicated in situations where the person's safety may be compromised by their physical illness or mental state. If the person with diabetes develops any of the contraindications listed, the CGM system must be discontinued and the CGM device managed according to the hospital's policy for storage of valuables. The person with diabetes, their parent or carer, is responsible for the day-to-day management of the CGM system if it is to be continued to be used whilst in hospital. During the course of the admission, the person with diabetes, their parent or carer must insert their CGM sensor when it is appropriate to do so, maintain the CGM system and linkage to their blood glucose meter, compatible smartphone and/or insulin pump, provide the necessary CGM consumables in the event that the sensor requires replacement, dispose of the used CGM sensor introducer needle into the approved sharps container, inform staff immediately of any hypoglycemia or hyperglycemic event, any alarms, alerts, or the event of CGM system failure. And importantly, despite access to the interstitial glucose results via the CGM, the person with diabetes and their parent or carer must be informed and be aware that hospital blood glucose monitoring is still required. Documentation that the person with diabetes has a CGM system in situ and that he or she or their parent or carer will care for this device during the hospital admission must be included in the medical record. As identified earlier, people with CGM require blood glucose and blood ketone monitoring still. As per our hospital standards, results of blood glucose and blood ketone monitoring are to be recorded on the regional LHN blood glucose and blood ketone monitoring chart, MR59H. The blood glucose results obtained from these capillary blood glucose meter tests must be used to assess inpatient diabetes management, and subsequent actions, including escalation, are to be initiated according to the colour zone. Every CGM system supplier has a free call 24-hour emergency helpline to assist people with diabetes, their parents or carers who have difficulty with CGM systems or experience CGM system failure. If a fault occurs during the warranty period, the CGM system is replaced free of charge. If the fault occurs when the CGM system is out of warranty, the company may often provide a replacement device. A replacement CGM system will be sent via express post to the person with diabetes nominated address. Whilst awaiting for the replacement CGM system, the person with diabetes should continue to or recommence blood glucose and blood ketone monitoring as required. The person with diabetes, their parent or carer, requires assistance with ongoing medical support, clinical care and education. If the diabetes team haven't been involved during the course of the admission, this could be considered during discharge planning, such that timely follow-up in the community setting can be arranged. The resources listed were referred to in the review of the clinical protocol and in the development of this training package. For further information, please don't hesitate to contact the RSS Diabetes Service. All online materials are available either at the Diabetes Services SharePoint page or through our website. Thank you for taking the time to complete this training package today.